long-term drug or alcohol abuse. So in fact, we're right on here when we're talking about it.
Yeah.
Aneurysms, tumors, stroke, you related to that earlier.
Yep.
Various diseases and disorders, falls and assaults. And we look at falls, especially in the senior element or in the baby element.
Yep.
You know, we often hear about babies falling out of cribs. You hope they land on their feet. I think I'd rather have a broken toe than,
Yeah.
you know, trauma to the head.
Yeah, definitely.
But let's go back for a second now, and we've encased how the opportunity here and how it can and affect the aspect. Is there consideration within the people to whom you've named about things they can do and can't do? Do they allow that to hold them back because they're not sure about whether or not that one foot's going to get placed in front of the other?
Sam is 15, so he pushes the limit every
Okay.
chance he can get.
Yeah.
And we kind of, short of it being one of those total, you can't see anything else happening but something catastrophic. We pretty much, he has to learn. And with Dennis, he wants to he would love to be able to ride a bull, but he knows.
Oh, well, we all.
Not me.
And I make that comment, and I don't think I'm normal. But anyway, having said that.
But I think what holds him back now more is the fact that he's married with 4 kids, and
Yeah.
that's more of a hold back.
By the way, we have an audience, and I'm not sure who the gentleman is. Is that
That's my husband,
related
Dennis.
to you? Eh?
Yeah.
And we talk about things like that, even though we're on camera. He didn't bring popcorn, I noticed.
No,
as
he
he's
didn't.
obviously.
Or coffee.
Anyway, let's talk for a minute about the possible effects resulting from brain injury. We've talked about the physical aspects of it, meaning the headaches, the altered speech, vision or hearing, paralysis, chronic pain, fatigue, loss of taste and smell, epilepsy and seizures, and dizziness. And you've touched on those because you've seen them happen.
Yeah.
And in your blogs, you've heard from other people that are saying these are the same things that are occurring to their loved ones.
Yeah. Yeah. And you never know. This morning, like I said, it's one of those mornings where you wake up and this is new development.
Yeah.
When we were in Winnipeg, I was staying at the Ronald McDonald House, and I went to Sam. One of the ladies who was there, and I thought it was awesome. She had bought for her daughter who was having some kind of treatment, and they were leaving, but they had a bag of chocolate-covered Oreos. So our thought was, oh, Sam, he's in the hospital. They gave him fish 3 meals a day for 12 days. We kept going down to dietary, fix this, fix this, fix this. They never ever did, so I would bring food. So she says, well, here are these Oreo cookies. Take some to Sam.
Yeah.
So we took them to Sam, and he was all excited, and he put a cookie in his mouth, and he spit it out, and he was dragging stuff across his tongue. He says, that tastes gross. It tastes like dirt.
Yeah.
So his taste is off, and he
Yeah.
can't eat chocolate.
Right.
It's different types of chocolates he
Yeah.
can't eat. So, and all of a sudden today this tastes horrible, and tomorrow it'll taste fine. But you don't know what it's going to be today. Is it going to be that your taste is off, or is it going to be that you're fatiguing, or is it going to be that this is the day that you're not going to be able to control your mouth?
Yeah.
Or
Heaven forbid, eh? But they at least recognize, because people in the professions, i.e. the teachers, and no disrespect, but your religious connotation, either the priest or the minister, friends, neighbors, other parent within, they would have to their advantage the recognition that there's something amiss here. So they would put up with and alter their day or their moment of time because of.
I'd like to say yes, but as you said, I live with it 24 hours a day.
Yeah, yeah.
And I will, turn and I'll snap at one of the kids, or Dennis, it annoys me sometimes. He will explain things 5 and 6 times so that he's got it straight in his head, but he's saying it out loud, so I'm taking it that he's reading, that he's,
Yeah.
and I'll say to him, like, I got it.
Yeah.
And then I'll think afterwards, like I totally blew it on that.
Yeah,
or Sam will have a day, like I said, where he's just going a mile a minute, and I'll just snap. And you'd like to think that people would, but for the most part, because it's invisible, that's where our biggest struggle is. It's invisible, so people totally forget.
Well, that's where we go back to what we talked about earlier in this interview, and when we said, you're the educator, but you also have to be the listener
Yes.
and the communicator, right?
Yeah, exactly.
So it's how you communicate. If you hear it 6 times, was it the same way 6 times?
Yeah,
So that's where you have to communicate.
right, and you have
Yeah.
to stop and listen.
Yeah.
And
But that's not his fault or her fault.
No, it's
Yeah.
and it's like everybody every day.
Yeah.
It depends on, and I look after, and everybody in the house,
Yeah.
and I'm having a bad day, and everybody else's day is just going along tickety boo, and
Yeah.
I'm just frustrated, and so then I got to stop and go, oh.
Yeah, and people are looking at you saying, "Hey, wake up, girl."
Yeah, well, I'd like to,
Yeah.
but
No, I understand.
so, and it is, but that is our biggest struggle with Sam, is that most people will look at him and Dennis and say, well, what are you talking about? They don't have brain injuries.
I want to ask, and this is probably the most touching question of the whole time we've been together thus far, but it's very meaningful if you appreciate where it's coming from. We often look at our children by saying, "Oh, they're just so perfect." Now hang on, I'm getting to that. I recognize that no, there's no such thing. I mean, I raised 3 boys. If you've got 3 boys, and there was never a day where I said they were perfect. Oh no,
No.
because any parent who tells you that, boy, there's something wrong with the parent.
Yeah.
But appreciate where I'm coming from when I say that. Does the individual look at himself as growing with the inability because of the brain trauma that he does have, and he will probably have for the rest of his life? But he doesn't let that be a holdback. He doesn't let that draw him back. He's still venturing forward. He's still putting that one foot in front of the other.
Oh yeah, yeah, and I think that's why, like for Samuel especially, he's my hero, because he, 2009 October 31st, the football team was playing in Winnipeg at the stadium, and
Right.
1 year earlier, he was literally still teaching himself to walk again, wearing army boots and marching up and down and playing
Yep.
on the Wii 3 times a day, 2 or 3 times to get himself his balance back and everything. And no, he didn't want special. When he joined cadets, his CO, I think you call Mark, he said, if you ever need to take a break, Sam, you go right ahead and do it. And I thanked him, and I said, I think because you said that to him,
Yeah.
Sam went, oh, okay, I don't need to take breaks. And so he just marched right on, and Mark said he never did.
Mm-hmm.
So but for Sam it was because he was given that allowance, and you know what, I'm not going to take it.
Well, it relieves the stress.
It does.
It takes away the trauma of the aspect of the thought that it may or may not happen. But
Yeah.
I'm not living with it. At least somebody recognizes that I can take that.
Yeah.
I understand. And that was a good move.
And it was. And for Sam, because like this year he just finally started school back full time.
Yeah.
He takes days off when he needs them, and we say to him, we can kind of tell a day or 2 ahead of time that this is what's probably coming up over the next little while, and go up and say to him, he's 15. What 15-year-old wants to go to school? And say to him, you know what?
Yeah.
Are you having a day? Do you need to stay home and rest? And he'll say, no, I've got this, and this I got to get done at school. I'll just go to bed early. And it's not unusual to see him go to bed at 8:30. Most parents who could appreciate that for kids, that go to bed at 1 or 2 in the morning,
Well,
and he's in bed at 8:30.
If my kid had done that at 8:30, I would have thought there was something wrong with him.
And
But I understand where you're coming from.
Yeah.
And you know what? I admire that in the young fella, because he's obviously put his life in perspective, because he knows how he has to treat his body.
Yeah, yeah,
So that's because he's living with it.
yes,
And
he
he's
is.
obviously doing very well with it,
Yeah,
from what you've told me and what he's involved in. So,
Yeah.
as is the other members of your family. Can't ignore them,
no, goodness.
especially when you got one sitting in front of you.
Yeah,
Let's talk about the cognitive aspects of this. Is slow to respond, memory problems, poor concentration, decreased attention span, poor planning and problem-solving skills, and impulsivity. The reason I bring it forward is because at least we're letting our audience know some of the things they can look for. Some of the things we've just mentioned here and talked about, you've obviously seen that.
yeah,
But you've also seen, from what we've just discussed, improvement.
yeah.
And now improvement comes from the educational aspect, the participation, he
Yeah.
with you one-on-one.
Yeah, yeah.
Okay.
Sam and I do. I have not missed a single doctor's appointment. So I've been everywhere. We've been literally from scratch to
Yeah.
now type thing
Yeah.
with him. And yeah, it's just, if he gets, like it used to be when he'd fatigue, it would take us a week or 2 to get him back up again. And in those 2 weeks, we would kind of start over again. He would go slack on the left side, and so I had forgotten about this, but Dennis reminded me the other day, when he would get fatigued and he would forget about his left side, and he would always use his right. So we'd say, "Oh, this is left-handed pizza." So he was so impressed with us, my dad. He could only,
Yeah.
and all of us, we kind of like, we're only eating pizza with our left hand today.
But all of yous are eating with the left hand.
Yeah, we tried to.
Yeah.
We tried. It was easy for Joshua because Joshua is left-handed, and so is Isaac. So maybe you guys
Yeah.
should use your right hand.
Yeah.
Just 'cause
Switch. Yeah.
But just things like that, and we haven't had to do it for a long time for him, but it was just a matter of repetition over and over again. And we'd say to him, "I'm sorry to have to say this, but
Yeah.
you gotta whatever."
That's
And-
why professionals practice.
Yeah.
So if we do a lot of correlation here,
Yeah.
which we have been doing, why should things change when it comes
Yeah.
to a young person
Yeah.
in that aspect?
Day to day, literally, you got to put your pants on one leg at a time.
Yeah. Yeah.
Oh, okay.
Well, I've always had this philosophy, and I think it works because we've had trauma in our house, and we've had to grow with it. We've had to live with it. We've learned. But I've always sort of had the feeling that for every step you back up, you take two forward. You don't lose.
Yeah.
You know what I'm saying?
Yeah.
But you keep that in perspective too. So,
Definitely.
last but not least, before we get on to your webpage, the emotional aspect of it, irritability, lack of insight, depression, mood swings, socially inappropriate behavior, and self-centeredness. These effects may be life-lasting or subside over time. That works both ways, I would suggest to you. Correct?
Yeah. Yeah. That really, as far as I'm concerned, everybody falls under that, whether you have a brain injury or not.
No, and I appreciate that,
And-
but it's part of the overall.
Yeah.
Yeah.
But for a lot of the stuff, I think it depends on, I guess it depends on how far you want to take it. Like for my dad, self-centeredness, I guess, because whenever we talk to him, it's always, he's very limited in what he says. But when he does talk, it's about things he's done.
Yep.
But it's not a cognitive thing that he's doing. Like he's not doing it
No.
consciously. It's
Right.
just, that's all he knows.
But that's a strength, you see.
It is, yeah. So it really depends on your level of
Yeah.
of injury, like, and that's where all of those come from. It all depends on what happened and where you're at.
But I'm sure in the educational aspect that you've had to involve yourself in over the period of time, that they've probably suggested that to you, is to work from a position of strength rather than a position of weakness.
Trying to think, yeah.
Work from strength,
yeah.
but introduce a bit of weakness each time.
Yeah, definitely.
So that you're not teetered.
not- yeah.
You're just a little,
Yeah, and it gets interesting.
I'm
like
sure it does.
we deal, like you said, when you deal with the inappropriate behavior.
Yeah.
I have we have issues that we deal with where I'm scared to go to Winnipeg with him alone. Not because he's
Yeah.
it's not a physical thing.
No.
It's just that he gets very
Yeah.
anxious, and
Yeah.
and I'll say, oh.
Yeah. You'll pull over to address them rather than
Yeah,
lean over
exactly.
and address them and have somebody else driving.
That's why I say, we need to have a button that says,
Yeah.
I have a brain injury
Yeah.
when we're in Winnipeg, so that he
Yeah.
can, people will maybe be just a little bit more understanding as
Certainly.
to why he's walking around making these annoying noises or
Yeah.
doing whatever it is that happens to be
Yeah.
that day's anxiety thing.
How is he when and you especially and or Daddy, when you're out walking amongst the crowds and a noticeable thing will happen because you'll detect it because you know him, and somebody sees it but is not quite sure. How's he handling it?
Honestly, I've never seen anybody else,
Oh.
but that's usually because I'm so busy trying to
With him? Yeah.
you
Yeah.
know, and but he has, and that is a brain injury thing.
Yeah.
Development, I guess, is that they do get very anxious in crowds. There's too much, because there's too much sound, too much smell, too much noise, too much stuff to look at, too much colors, too much busyness, too much energy, too much of everything. And it's I'm reading a book right now called The Smile on My Forehead by Jennifer Mosher. She's a brain injury survivor of, I
Right.
think, 15 or 16 years.